cultural clash with traditional Chinese medicine, TCM. In many cases, patients' cultural backgrounds conflict with the fundamental logic of TCM. Western medical thinking tends to emphasize directly attacking an illness, while TCM often aims to restore and maintain a dynamic balance within the body. For example, a patient with liver cancer underwent surgery under anesthesia to remove a tumor. A week or two later, he consulted a TCM practitioner to assist with recovery. Post-surgery, there can be residual congestion, blood stasis, and impaired circulation in the liver. TCM treatments might use herbal formulas and acupuncture or other modalities to improve blood flow, which can sometimes cause mild discomfort. As circulation is restored. However, because the patient was unfamiliar with TCM's approach, even slight pain prompted suspicion that TCM was causing harm. Ironically, he accepted the more intense pain controlled by anesthesia during surgery without question. This situation reflects how differing cultural and medical expectations can make TCM therapies appear confusing or even alarming to patients who are more accustomed to Western biomedical methods. Patient allergic to Chuanxiong, Sichuan Lovage root. Another illustrative case involves a patient who believed he was allergic to Chuanxiong, Ligusticum Chuanxiong, a TCM herb frequently used to invigorate or regulate blood flow, promoting blood circulation. When he later became ill, his shui, vital energy, and blood were significantly depleted. The TCM doctor chose a minimal dose of Chuanxiong, combined with other herbs specifically selected to mitigate any allergic reaction. This approach allowed the patient to benefit from Chuanxiong's circulation boosting effects without showing any actual allergy symptoms. Despite recovering, the patient stumbled upon a high-profile lawsuit in which someone had sued a TCM practitioner over an alleged herb-related issue and won a large settlement. This prompted him to revisit the prescription, noticing the label stating he was allergic to Chuanxiong. Lacking an understanding of how TCM formulas integrate antidote herbs to counter potential side effects, he sued the practitioner. Although he admitted in court that he had recovered with no adverse reactions, he still maintained that using Chuanxiong was wrongful. Situations like this demonstrate the cultural and educational gap around TCM practices. As a result, TCM practitioners may feel compelled to use conservative, less targeted formulas to avoid legal trouble, even though stronger, more precise prescriptions could yield better outcomes. Many patients trust TCM more readily if they share a background or openness to its philosophy, which includes concepts of yin-yang balance, qi circulation, and holistic harmony. However, decades of Western-centric education in China and worldwide have made it more challenging for modern patients to appreciate TCM's rationale, especially when it diverges from purely symptom-focused or anti-pathogen approaches. Unrecognized TCM benefits. Although TCM can produce marked improvements, these benefits are sometimes overlooked by patients who rely solely on Western diagnostic markers. Consider hypothyroidism, where a patient may experience low energy, lower back soreness, mood disturbances, and disrupted sleep. A TCM regimen over 2 or 3 months might resolve many of these physical discomforts by addressing underlying imbalances, e.g., qi deficiency, kidney yang weakness, or spleen qi insufficiency. But a follow-up blood test could still show elevated or abnormal thyroid hormone levels. From a strictly Western perspective, the lab numbers trump the patient's subjective improvement. This mismatch often leads patients to dismiss TCM in favor of lifelong reliance on synthetic thyroid hormones. Western metrics like lab results cannot always capture the TCM focus on the body's self-regulatory capacity, systemic balance, and gradual restoration of function. Broader scope of Chinese herbs. Contrary to the assumption that TCM only uses locally grown Chinese herbs, many foreign-sourced ingredients such as frankincense, myrrh, and saffron are also incorporated into TCM formulas, provided they fit the principles of balancing out yin and yang, regulating qi, and addressing the root causes of disease. However, simply isolating chemical compounds in laboratory conditions misses the interactive nature of TCM herbs with a living human system. When TCM is reduced to botanical medicine, purely defined by chemical constituents or pharmacological action, the holistic aspect, often referred to as an herb's high quality or energetic signature, goes unrecognized. This is why many TCM clinicians emphasize clinical observation and holistic diagnostics, including tongue inspection, pulse taking, and symptom pattern analysis, rather than relying exclusively on laboratory findings. Daodi, Geo-Authentic herbs, and proper harvest. Some TCM herbs address deeper layers of health, including disturbances in the patient's Shen, spirit, or mental emotional aspect. Certain Geo-Authentic herbs, called Daodi, are grown in specific regions believed to impart unique environmental properties that enhance an herb's therapeutic potency. Examples include Shangdang-grown ginseng, Panax ginseng, or Ningxia goji berries, Lycium barbarum, because they are cultivated in their ideal ecological niche. These herbs can contain a particularly robust qi quality, making them notably effective for treating imbalances. Harvest timing also matters. Picking an herb too early means its active components and energetic properties haven't fully developed. Beyond these agricultural concerns, one must also consider how an herb's different parts serve different functions. For instance, in Angelica sinensis, Dangui, the head part, Dangui 2, has a stronger effect on elevating blood. The body portion, Dangui Shen, primarily nourishes blood, and the tail section, Dangui Wei, is better for breaking up blood stasis. A purely chemical analysis might not distinguish between these different clinical effects, yet such distinctions are critical in TCM practice. Mahuang, Paozhi, herbal processing, and regulation Mahuang ephedra offers another lesson in TCM's nuanced perspective. Its above-ground stem is used to induce sweating and relieve external invasions, e.g. common colds, while the root has the opposite effect. It halts excessive sweating. Examining ephedrine content alone cannot explain how one part of the plant promotes sweating while another inhibits it. This duality is a testament to TCM's emphasis on each herb's specific meridian entry, energetic direction, ascending versus descending, and synergy with other substances in a formula. Paozhi, herbal processing, is a cornerstone of TCM that involves preparing raw materials by roasting, steaming, soaking, or mixing with specific substance to optimize their four nature: cold, hot, warm, cool. 5 flavors: sweet, sour, bitter, salty, pungent, and directional tendencies. For instance, Hisho Wu, Polygonum multiflorum, is often repeatedly steamed with black beans to reduce its natural toxicity, so it can safely tonify the liver and kidneys. Modern regulations, however, sometimes emphasize restricting dosage instead of championing correct processing methods. This approach can diminish the therapeutic potential of TCM herbs and inadvertently push TCM toward a more constrained practice environment. Discrepancies versus clinical efficacy. In some cases, Herbs that test high for certain compounds in a lab setting might not deliver the best results in clinical practice. Meanwhile, an herb with a less impressive chemical profile may prove more effective for actual patient care, suggesting that TCM's holistic clinical testing extends beyond standard biochemical markers. When TCM is forced to fit into a solely Western scientific mold, many intricacies, such as the role of qi, the concept of shen, and individualized pattern differentiation, are hard to quantify. TCM seeks to nurture health in a comprehensive manner, observing systemic improvements in long-term vitality rather than focusing narrowly on isolated data points. This holistic perspective is both its greatest strength and the toughest challenge in a world that often demands clear, numeric proof before validating a medical approach. Translation notes for key TCM terms. 1. Qi, vital energy. In TCM, qi is the fundamental life force circulating throughout the body, essential for overall health and balance. 2. Yin and yang, complementary principles in TCM representing opposing but interdependent forces, e.g., cold, hot, interior, exterior. 3. Shen, spirit, refers to the mental, emotional aspect of a person, which TCM views as integral to health. 4. Meridians, channels, pathways in the body through which qi flows. They connect organ systems and can be regulated via acupuncture or herbs. 5. Blood stasis, a TCM diagnostic concept where blood flow is obstructed, leading to pain or other dysfunction. 6. Daodi, Geo-Authentic herbs. Herbs grown in their traditionally recognized best region for potency, often with specific local conditions that enhance their effects. 7. Paozhi, herbal processing, preparatory methods such as steaming, roasting, soaking, used to modify an herb's properties, reduce toxicity, or target specific therapeutic action.